Okay, yeah.
Okay, I'm glad your patient's so settled. Ready for report?
Sure.
Yes.
Yeah.
Okay.
Alrighty.
I have
So-
this if you want to write them.
I'm the PACU nurse giving you a report. You're on the surgical floor and you're receiving Matthias Hedding. He is a 62-year-old just coming out of the PACU. He is Thursday at 13:30. And he came in yesterday with a wound infection in his right foot and heel. So we took him to the OR and debrided that. He has a gauze dressing. It is clean, dry, and intact. There's actually 2 small ones on that right foot. And his pain is controlled at 4 out of 10 right now. He has a history of diabetes and heart failure. His lungs, he did have a few crackles in them.
Okay.
I went over how to use the incentive spirometer for him.
Okay.
His pulse rate has been in the 80s. Blood pressure 130, 140 over 80 to 90 diastolically.
30. What?
130 to 140 over
130
80
to
to 90.
Okay.
Kind of high.
Yeah. Bell sounds are good. Last problem was yesterday. He has 2+ radial, 2+ pedal pulses. There is a little bit of edema to that right leg. He's allergic to iodine. He has a right forearm IV through which he has half normal saline at 100 an hour.
How much?
100 mils an hour.
Normal saline?
Half normal saline.
Half normal saline.
The post-op orders are in the computer. Kind of it. No nausea, vomiting. He has ice chips and he's to be progressed to a ADA diet.
All right.
Any questions?
Any
It was a
nausea,
quick procedure.
vomiting?
No
No.
nausea, vomiting with the ice chips.
Is he able to turn, cough, and debrief in the PACU?
Yeah, absolutely. And they told me that he was just a standby assist. That foot gives him some pain when he walks on it. And he is getting up ad lib.
Okay.
Okay,
All right.
perfect. Thank you.
Some gauze. I have a. Here we go. I have alcohol pen. Nice. So we just kind of go from here, I guess. Or do we wait for any cue?
Oh, we. No.
Yeah.
Maybe
Okay.
choose yourselves.
Do you want to just start? Okay.
Good afternoon, Mr.
Yeah.
Matthias. I guess we start.
Mr. Matthias.
How are you doing today?
Do you want to do intros?
No, hold on. She's.
Okay.
A lot of pain. I guess my OR went okay, the surgery.
The surgery went okay. So I'm Kevin. I'm one of the nurses here.
I'm Logan. I'm also one of the nurses here today.
Can you tell me your name and date of birth?
My name is Matthias Hedding, and I was born August 14th.
Okay. Any allergies?
I still have allergies. It's some sports stuff they put on me, iodine or something.
Allergic to shelter.
And what happens when they put iodine on you?
It's kind of a rash.
Kind of a rash? Okay. So you said earlier that you had pain. If you could rate the pain from 0 to 10, 10 being the worst, what would you rate it as?
Oh man, it's a 9. It's really.
It's a 9. Is that it? 9? Okay.
A 9.
All right. Well, do you want to go ahead and grab a set of vitals for a minute? I'm going to go ahead and check. So can you tell me where the pain is at?
Probably in the right
What's in
foot.
my right foot?
Let's take a peek at it.
Careful, ow.
Just do it gently.
All right.
It really hurts. Really careful.
Can you describe the kind of pain that you're having?
Awful.
Awful. Okay.
Awful pain.
All right. So if you would just want to check the MAR to see if
Yeah. Let's see if we have
Mr.
anything
Matthias
for
has
him.
anything. I'm going to go ahead and take a quick listen to your heart and lungs.
She didn't do anything about it.
What?
The nurses hurt a lot. It was starting to hurt, but she didn't do anything about it.
Well, we're here now. We're going to take care of you.
Guys.
I can like hear it almost better through the door.
All right. I just need you to take a quick deep breath.
So today is supposed to be Thursday? Okay.
Wait, time out. Does he breathe?
You should.
Not breathing.
No?
Oh.
Well, then start compressions. He's.
Oh no.
It's breathing. Listen.
Is it? Alright, can you hear it? I'm gonna take a look at tomorrow, okay? See if there's anything. So we have morphine from the morphine injection every 2 hours. Do you know when the last one was done? Oh wait.
Your lungs don't sound too good, sir.
Alexis or
Okay.
Blood pressure. Taking it down. Alright, I need you to.
I don't want to do that thing. I hurt too much.
It hurts too much. Well, can you at least cough for me?
Can we do it later?
these are all the
Does he have an order?
I think we can.
Is this?
That's
I'm
the
technically
eyes.
coming out of the
This
bedroom.
hurts awful.
This isn't nice. We need a table here.
Just put it right here.
Okay.
Yeah, we can. Looks like we have a PRN for morphine.
All right, so it seems that we have some medications for you. We're going to be administering here shortly.
It's morphine.
I mean, I heard it from here.
Yeah.
Morphine. You're going to be receiving some morphine.
We can also do. Yeah, we can only do that. He's on ice chips right now, so.
No. Well, I can't hear what she said.
Get addicted. I have a friend who was surgery and got addicted to that stuff, and he was a hot mess.
Okay.
Okay, so you had a friend that was addicted to morphine and he's a hot mess? Yeah, okay.
Okay. We also have a acetaminophen, but it's on ice chips.
We also have some Tylenol. Does that sound like an acceptable solution? If
I don't
it's-
know what do you think?
Call the doctor and tell him.
I don't want to get addicted.
I mean,
I don't know what to tell him now. It's up to you. What's an acceptable pain level for you, man?
Okay, Logan, what do you mean?
On a scale of 0 out of 10, what's your pain level now?
he said 9.
9?
He's at a 9.
And what would you
Now
like?
it's a 9.
What's an acceptable number for you? Do you think?
This is running.
Like, acceptable, what do you mean?
Something that you can tolerate,
So give him a number.
like maybe a
Or a
5 or
chart
a
or
4
something.
4?
out of 10.
So while I understand your fears of getting addicted to morphine, this is.
Well, we have this, but they don't want to take it, so. Now what?
Well, you would walk them through it and see. So his reason for not wanting the morphine is due to the fact that his friend became addicted to morphine. So that's a very valid fear. I completely understand that fear that you might have.
This oxygen is pretty low, by the way.
Well, that doesn't work. Oh, but he also has to cough.
Oh man, this foot hurts. This is awful.
Okay, so we have Tylenol we can give you for pain since you. So then, would you be refusing the morphine?
No, I just don't want to get addicted. I can't just go away, but I don't want to be addicted.
So this would make your pain go away, and
I'm really
you.
scared.
What are you scared of? Becoming addicted?
Yeah, they talk about it. All I see on TV is opioid crisis on intervention. I watch that show all the time.
It's just one of those things you're gonna have to decide if.
So the dose that you're receiving is 2 milligrams.
To recommend, you're the nurse.
Right, the dose is 2 milligrams.
2 milligrams.
So you're going to be receiving 2 milligrams of morphine. We'll be putting it through your IV. It'll help you feel better instantly, or pretty close to.
It's gonna help with your foot pain.
Okay. You think that's for me?
That's what we have available from the doctor's orders.
I trust you guys. What do you think?
So there's no indications for his PRNs. If we start there. In the order. There's
Yeah.
no indication for it. So
So now, I mean, that's what it would generally be used for.
it would be used for pain, but I would say at least.
What for? Yeah. Maybe wait for this to load. Is his IV working? Seems to be.
It's connected, it's flowing.
Okay.
It's technically here. There's no.
I didn't say what you want now.
Sorry?
Didn't hear what you asked.
I said there's no indications for any of the PRNs that he has.
What's this for? Just stretch.
You want to call the doctor?
Yes, we would definitely call the doctor
Yeah, I think we should call the doctor and wait
and clarify the order.
and make darn sure that this is correct.
Yeah.
Come in.
Is that the doctor?
Well, let's look.
That's-
This one's knocking.
Sorry, the door's locked. If
Okay.
you're gonna call me, I'm here.
Okay.
All right, so who's
So-
calling?
I guess I will.
Okay.
So we have 62-year-old Matthias here who
Uh-huh.
just came from PACU.
Right?
He's complaining of pain. He had surgical debridement on his right foot.
Uh-huh.
Complaining of pain, but he's worried about being addicted to
Morphine.
no
So you
pain.
can-
Have you reassured him and talked to him?
We
Yeah,
have-
talked to him.
Tried.
Okay.
He's still adamant that he doesn't want to become addicted to morphine. His order for PRN does state morphine, 2 milligrams every 2 hours. He also has an order for acetaminophen, but he's
Yeah,
not.
no, that's not gonna do it. I did a big surgery on him. Let's go ahead and do this. Let's just reassure him. Let him know that, he's not gonna get addicted with 1 or 2 doses, and we'll move forward from there. In the meantime, I'd probably get his foot off the bed and elevate it a little, maybe an ice pack and some non-pharmacologic stuff too. Sound good?
Okay.
Perfect.
Yes. So reading that back, elevate foot, reassure patient
Yep.
with morphine.
I realize they're over here.
And if he
Ice
still
pack.
refuses, give me a call.
Okay.
Perfect.
Sounds good.
Thank you.
Thank
So
you.
we have an ice pack. We have a washcloth we can cover
Can
it
use
with,
those.
or to some degree.
As far as moving this, do you want to help me so I don't?
Hi, Mr.
incur any
Matthias.
damage?
So we just spoke with the doctor. He reassured us that you will not become addicted. What? He reassured us that you would not become addicted to morphine. So we have an order to give you 2 milligrams of morphine through your IV. We're also going to go ahead and elevate your foot to alleviate some of that pressure, and we're going to give you an ice pack. Does that sound acceptable to you?
Okay, thank you so much.
Okay.
Try not
Yeah.
to touch the heel there, huh? 'Cause that's where it's at. Do you want to take a peek at it while I'm lifting this to see how it looks? Make sure it's not bleeding everywhere.
Oh, it really hurts.
Okay.
Okay. That
We just had to
answers
take
my
a peek
question.
at it since we were lifting it already. Trying to consolidate your care.
Can you wiggle your
It is
toes?
awful.
Can you wiggle your toes?
I still can't.
I can't hear anything.
It's so blurred. Can't understand.
What if I raise the volume? Do you think that'll help?
Would you mind
Anything else?
Would you mind
Yeah.
repeating that? Thank you.
What did you say?
Would you remind?
What did you just say?
Yeah. Would you mind repeating what you just said?
Get my heel off the pillow, it really hurts.
Heel off the pillow because it really hurts.
We could move it up and have it. I don't know if we want to dangle
Yeah,
it.
it's rubbing on the bottom.
It's rubbing on the bottom.
I guess better.
How's that?
Much better. Where do you put my spine?
Just right on the foot. It's a small ice pack. Okay.
Are you able to wiggle your toes? I can't do that very well.
Okay.
Are you able to move your right foot at all? Can you press down on that?
It hurts, so let's give him the morphine before we
Yeah.
move forward.
Okay.
I am. It's just really sore because I touch my toes.
Alright, so Logan's going to prepare your morphine injection, or your IV.
Okay.
Thank
Thank you.
You're welcome. So, can I have you sit up a little? I'm gonna listen to your heart and lungs one more time.
This one's never been used.
All right, take
You're
nice
doing
deep
my med
breaths.
checks.
Thank you, sir. Actually, I'm gonna listen to your stomach real quick.
Okay.
I'm gonna just dilute it in here. Unless, since this already has a,
Would I even be able to hear bell sounds on the mannequin? Okay.
Hey, what happened to my food? My McDonald's, it was sitting on the side there and it's not there anymore.
It's.
oh shit. It was trash. I was cleaning up the, do you want to put that back?
Did you throw it away?
Yes, because it was trash. It was stuff that was, was in the way.
So it has been thrown. So we'll have to get you something
Yeah. I
else
threw it away. I'll have to get some more.
It's hospital food now, huh?
to your liking. I'm sure we can get you something from the kitchen. So you are just now. He's not NPO.
Uh-huh.
So you'll be starting your diet. So part of that, let's remember that it includes low sugar, high protein, no, low protein. No, I think that's enough kidney failure.
Do you have another one of these? I want to check for patents here.
Well, it's running.
That's true. It's just I gotta have it.
You need alcohol, which you have. All right, so Logan here is going to be administering
What do you have for me?
some morphine.
I have 2 milligrams of morphine that.
Did you
your
bring them
doc-
with you? Did you scan the patient? Did you verify it?
I verified
Okay,
the
how long
medications.
is that going to take to work?
Well, since it's IV, it's going to be pretty quickly, so you should hopefully have some pain relief in
You'll
the next
feel it in the
5,
next
10 minutes.
5-10 minutes.
Okay. Thank you.
So, one more time. Let's go
Yeah,
ahead and...
want to click on that. Oh, you can't do that.
Yeah,
Oh,
wherever the scanner is.
thanks, sir.
All right, I'm going to go ahead and scan your wristband real
I
quick.
figured that was non-functional.
That works.
Thank you.
You're welcome. Please scan the appropriate medication.
It's the, yeah, perfect. Please scan the patient ID. So did you get their
Please
wristband
not
ID?
verified. That's not verified.
We're just waiting to verify your medication here. Yeah,
Yeah, we're just having some...
we just have to rescan your armband here and hopefully the computer likes it.
Please scan the appropriate medication label to continue.
Okay.
Did I scan the wrong one?
No, it's morphine.
Well, did you verify it? Morphine 2 ml.
Mm-hmm.
Give me my minute.
So,
Fine, proceed without scanner, not verified. Why does it say not verified? Administering time.
so we're gonna have to manually verify since the computer is
have
having some sort of glitch.
Sure, my name is Hedding. I was born August 14th. And I'm allergic to iodine.
Okay.
Thank you, sir.
Just like right now.
Cannot be administered in the future.
So maybe try 36.
What time? No, well, what time is the scenario? Thursday, 13.
13:15.
13, 26, 25. Cannot be scanned in the future. Oh, because I don't get it. Okay.
Patient ID. So we're having an issue trying to get this scan.
All right, one more time. Whoa. What is it supposed to happen?
It's coming. Maybe click that the first time.
Not verified.
Hopefully just another minute here we can get this cleared up, okay?
The page is really bad, guys.
I just don't want to proceed without getting everything
Well, we have
legally.
the doctor's order, so.
Okay. This has been wiped off. I'm just going to keep it on there so it's not out in the open. It's not going to scan. I don't want to proceed without getting this verified.
Then just verify it. Doctor, we just did. We verified it. Huh?
I don't know if that's
You
acceptable.
can bypass the
Okay.
scanner.
Okay. This has been diluted a little bit.
Well, because we did verify with the doctor when he said go ahead and give the morphine for severe pain. And you're going to educate the patient.
So yeah, just tell us if you report, excuse me, just let us know if you have any difficulty breathing or notice any
We'll
adverse
be
effects.
monitored.
Okay, thank you.
In the meantime, I really encourage you to take a nice, deep breath.
All right, I'm taking a deep breath.
Okay, and then since this is pumping through,
It was supposed to infuse over 5 minutes. Well, 2 minutes at least.
3 to 5 minutes.
3 to 5.
But I diluted it.
Okay. How are you feeling?
All right, we're done, you guys.
Okay.
The computer wasn't working.